This was one of the biggest natural disasters in American history. It was, I think, the biggest in the last century in an American city, in a U.S. city. Hundreds of thousands of homes were affected. Hundreds of thousands of people were displaced. More than 1,400 people lost their lives. And we thought we needed to set out and look at whether this was a man-made problem or this was an act of God. When Hurricane Katrina came to New Orleans, it was not a Category 5 or a Category 4. It was not even a Category 3 when it hit the city of New Orleans. It was a strong Category 1, weak Category 2 storm. And the problem that affected this city was not the hurricane and the winds. It was the storm surge. It was the fact that the levees were breached or failed, the flood walls failed. The city was inundated with water from the storm surge. So this was not even that great of the big storm, as they called it. What we found was that for years there were reports, testimony, audits, studies that were warning that something like this was inevitable and that there needed to be prepared. The city needed to be prepared, the state, the federal government, and yet everything collapsed anyway. Patients were stranded for days in the hospitals with the staffs of the hospitals. They couldn't get out. They hadn't evacuated. Many of the hospitals had kept their emergency generators in the basement, and they were flooded. And this despite the fact that a couple of years before in Houston there had been a terrible flood, and the same thing had happened, and they had learned there that they had to move that equipment upstairs because of flooding. So this wasn't a new idea. You had patients, elderly people, very sick people, people in intensive care, lying in beds in terrible heat, with ventilators that weren't working. The doctors were hand pumping people to keep them alive. You had very little done in the way of rescue during that time. It was confusion and chaos. They couldn't get out. The staff, I'm sure people have seen pictures of staff on the roofs of some of these hospitals with big signs asking for help, please rescue us. It was a terrible situation here in the hospital system. And it wasn't just the hospitals that seemed to collapse during Katrina. You had situations in which the National Disaster Medical System, which is a system set up that's run by FEMA, that's part of the Department of Homeland Security, and they are supposed to be the ones that come in and assist states and local governments and healthcare systems during a disaster to triage patients and evacuate them. And that system also seemed to collapse, or certainly didn't do a very effective job during Katrina. You had a situation where thousands of people were being dumped out of hospitals and nursing homes and from rooftops, people who were patients who were ill or injured or elderly, and dumped on the interstate highway, its staging areas. They were just dumped there by helicopters in anticipation that they would be rescued and someone would get them out of there, and they weren't, and they sat on baking in 90-degree heat with no medical care, no water, no food on highways. It was a terrible situation, and I wrote about a young doctor who came upon this situation by accident and decided to stop and help, and turned out to be the only doctor on the scene for some time, helping thousands of people, trying to triage people, and it was completely by accident that he was there. And that we look at the history of the National Disaster Medical System and find that there have been a series of audits and reports and congressional testimony over years about some of its inadequacies, its understaffing, its ineffectiveness in certain areas. When I came to New Orleans the first time after Hurricane Katrina, it was in May of 2006, and the thing that shocked me the most wasn't the destruction, which was terrible in many areas of town, from Lower Ninth Ward to Lakeview to Gentilly to New Orleans East. All of these areas were terribly affected and were in very poor shape. But what was really shocking to me as an outsider coming in to report on this was that this was 9 months later and how bad things looked. There was still no electricity in most part of the lower Ninth Ward, where a lot of people's houses were. There was no potable water. There were no FEMA trailers. There was nothing. And I couldn't understand how in an American city in this century, 9 months could pass and it could still be, the conditions could still look like this and be like this. That was the most shocking thing to me. And a lot of people who come here from outside, I think that that's their impression when they come, is how slow the progress has been.